Nursing informatics is really specific to the nursing specialty. So a doctor is trained to be a physician. They are trained to diagnose and make an assessment. And a nurse is really trying to sort of follow a physician's care plan, but we are also really involved in the day-to-day activities and nursing care workflow specific to that patient or sets of patients. So nursing informatics is really about being able to translate what we do in our practice, whether that's day-to-day activities of truly interacting with that patient, or even using our clinical knowledge to support physicians or other interdisciplinary members of a healthcare team. We're taking all of that and trying to improve the technologies that we're using to either serve these patients directly or even to serve the doctors or the interdisciplinary team members to meet the goals of that healthcare system in general. That could be the healthcare system within the hospital setting, the healthcare system within the clinic, the healthcare system within the community, right? So it's that intersection really between us nurses, the rest of the interdisciplinary team, and then technology.
I was there as a program assistant for HIMSS itself. So HIMSS have this amazing program where they allow students to work for them and also experience the learning opportunity that HIMSS provide, and also connect with all those health IT tech like exhibitor at the exhibition hall. It's like you get a lot from there. Working experience, education sessions, and keynote speaking that will help you to boost your knowledge, and then also networking and also learning about the companies that you may want to work in future. So it's a lot of things that you are getting from him. Yeah, I was everywhere. I was like there in a health IT summit a few months ago at Bethesda, and there was like lots of IT things like a session going on, and I kind of like figured out it will be same in the hymns, but it was like whole next level. We have AI in everywhere. The most important thing I was intrigued by was a session at HIMSS where it was like two of the behavioral health practitioners who were talking about how they are trying to use generative AI for like psychotherapy like session. And I was really amazed by to know that like patients are more comfortable asking question or talking about how they feel or their thoughts to the Gen AI tools rather than the like person itself, because they don't have fear of judgment or fear of like getting their information like sharing their information to someone that they know. And that was really a like kind of situation for me. So I think like as everyone said, AI is the technology, so human need to be there to run the technology, right? But those kind of technology like AI or any other like automation technology or like development technology, those help us like to make our output better, but we can improve boost our productivity or maybe the accuracy. We can use those tools and techniques for our betterment of healthcare outcome or for healthcare. So we can use those technology or like tools for like healthcare equity and like making like outcome better.
Yes, I think that AI is such a hot button topic right now. Everybody's talking about it, how to use it, how do we implement it. And I think the biggest thing for my job is just finding efficiencies with it. So, not necessarily taking away our great brains of putting those insights and recommendations together, but on the day to day, how do we make data processing go faster? How do we tag things faster? How do we do like a quick sentiment analysis using this? Or even proofreading. So, going in and if we have a block of text and thinking, okay, I can go in and edit this, maybe it'll take me a half hour, or I can ask the AI, hey, can you cut this down for me from 2 paragraphs to 5 sentences. And so those types of tasks where it just makes your day-to-day easier.
Yeah, but maybe in the most succinct way of explaining it, I like to think about data architecture as making sure all the different systems align with each other. And usually that's in the form of like a pipeline. So let's say in a hospital system, you have to order medications. There might be a system that allows a physician or nurse practitioner to order a med. Okay, that's like your ordering system. There might be another system that allows you to verify those medications, especially for your pharmacist. There might be another system that dispenses like all these different systems, right? In the back end, in our electronic world today, the data has to flow through all these systems.
Right.
And if the data up here, let's say in the computer system in the back end, a drug is represented as code 123, but all the way down here, when you're dispensing the medication and the medication doesn't have that code or has no code, then it just doesn't connect. So our data architects really make sure across your entire system, make sure that the pipelines for where your data flows all align with each other. So they make big architectural decisions, making sure all the different systems are aligned and you work cross-functionally with a lot of different teams. It's really fun stuff. Yeah. So I think you'll probably get a different answer from different people. And then the way I like to think about that question is AMIA, so American Medical Informatics Association, they do a pretty good job of like breaking down some of these groupings. And so they have like 5 groupings of biomedical informatics, what falls under. But there's one that is called clinical informatics. And then the way they define that is individuals that work in areas where there's like a healthcare provider and a patient. So kind of like a one-to-one relationship, right?
Okay.
In those scenarios, whenever you're working on or building technology that impacts either the provider or the patient or some mix of the two, it's clinical informatics. And then from there, you can further split into dental, pharmacy, nursing, physician informatics. And I think the separation, which is more your question, is usually in regards to the type of work that practice does. So nursing might be involved in more of the medication administration designs, like what the technology looks like when you're giving a medication, because that's what nurses do, the different tasks, because they usually have task lists, what that looks like, how that impacts their workflow.
Put them in 2 categories. So when I started working at that company, when I first hired, I was a fresh analyst. What I worked on was just break fix issues. What that means is that if something is not working correctly in Epic for an end user, in an EHR company, right? It's an electronic health record company, and it's a software at its base, and it's customizable for people that have access to it as a certified Epic analyst. And what you can do with that is a lot, honestly. If you have a workflow that you want to update, an Epic analyst would do that. And how hard to explain it without showing you like what exactly we're doing. But if you can think about it, it's like a software engineering job,
Okay.
or without code. You just move things, you point and click through things, and you have to learn the relationship between data. So
Mhm.
that's the main part. Like what do you do on the back end? You have to figure out if you update this column here, you update a record on here. How is that going to affect this other record here that does something else inside the software? A entry-level analyst would do, would just look at where that row of data is that's wrong, the record, and you would just remove it or add something else that was missing, what you do as an entry-level one. But if you're intermediate or advanced, then you start analyzing these connections at a wider level. You start seeing the relationship between multiple databases, and based on that, you can build bigger things stuff. So they call them like builders, like Epic builders sometimes, because what we do is build on the back using the EHR. So I'm not sure if that explained it well enough, but and during that job, what we pretty much did was we learned multiple applications. So Epic has a bunch of applications. It's not just one application. Each trainer taught by a primary trainer in his applications. And then at the end of the training of that, it was an in-house training, we were tested in our knowledge of the application. So we were able to teach it into primary trainer, then we passed and we were credentialed. So that's what an Epic credential trainer is. It's just getting like passing the test in-house in your healthcare organization that is assessed by the primary trainer. So if you pass that, then you become a credential trainer. And then I just started teaching how to use the software. And I feel like what helped me a lot with that job was my experience using the Epic EHR app. Kaiser, working as a front desk person, I was teaching the ambulatory application. I was teaching the Willow application, and then I was also trained in Healthy Planet. So
Yes.
the ambulatory application is the application that deals with outpatient clinical documents, but anything that's outpatient, right? The Willow application is the pharmacy module that Epic offers. So anything related to pharmacy, that's the Willow application. And then third, it was the Healthy Planet application, an application that deals with population health. So tracking the health of a patient outside of the hospital, things like social determinants of health or like medication management, like they're following up on taking the medication. Someone always follows up with the patient and make sure that they're following the guidance that the doctor set out for them. So I learned those 3 applications and I was teaching doctors, nurses, pharmacists, pharmacy techs.
As a biller, typically you come into the office, or if you're working remotely. Now we're in an electronic environment. So oftentimes your providers have already coded their claims. They've gone in and their coding is usually comprised of their charting, right? Because if you're working in an EMR, the provider is using the EMR to do his triaging, their assessments, diagnosis, treatment plan, etc. So typically as a biller, you either have a coding department if it's a larger organization where they will review the codes and prompt them for submission. And the billing team would then be in charge of getting that claim out the door and then taking all the steps thereafter. If you're a smaller practice where they don't separate coding from billing, you're going through each chart, making sure that the charts are coded correctly, because sometimes providers do undercode based on their documentation. They don't like to document, so they undercode. So you want to make sure that the coding makes sense, that the modifiers make sense, and you want to get those bills out the door. So a medical coder is really diving into the meat and potatoes of coding, of understanding different body systems, understanding how to code multiple procedures, modifiers. It takes you really deep into reading operative reports and understanding how to extract information for coding purposes from those reports. A medical biller, however, is in charge of making sure that bill actually gets paid. And there are so many different factors that go into it, making sure that whatever insurance company you're billing, that your provider can bill that insurance company, making sure that if the service requires authorization, that you have the proper authorizations, making sure that when you submit the bill, that something as small as having wrong information in the demographics can cause your claim to get denied. So a medical biller is essentially in charge of taking different data points, which include coding, incorporating it into a bill, making sure that bill ultimately gets paid and reconciled in the practice management system. I think that there's a big misconception with AI right now, where AI is a very big deal. And I think that people assume that AI can replace humans. And you have a lot of people on the human side that are very afraid of AI, and they will not embrace it, but it's here and it's not going away because it's in our field and we're going to have to deal with it. But I think on the other side of the coin that you meet a lot of these vendors who are selling these products and over promising on what the product can do, because it requires human supervision. So I think the biggest misconception in healthcare right now is how to effectively leverage technology in our space. And we are really going to need to have some meaningful discussions around that. Why? Because you have the human element that's afraid of it. You have people like me where something new comes out and I'm like, oh, let me see how that works. But then you have people that say, I don't trust it. It's listening to me. So you have that element. But then you have the element of all these new things coming out where these people are overpromising. And unless you understand how the process works, if you don't understand how the process works fundamentally, how are you going to know if what they're selling actually going to work for your practice or you're just wasting money?